Okay, this is the book Prevent and Reverse Heart Disease by me. Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. We're on page 24 if you're following along in the book. Okay, so who was a nutrition genius in the 1970s and 80s who cured lots of patients with diabetes, hypertension, and heart disease and a low-fat plant-based diet? Nathan Pritikin. Okay, Nathan Pritikin was a great genius. He thought he was going to die himself of coronary artery disease. He had been diagnosed around 40 years of age with severe coronary artery disease, abnormal EKG, abnormal stress test. And he then wanted to figure out how to save himself. He had become wealthy. He's sort of an engineer, inventor, genius. And he had the time to read, and he read. He went through all the literature on nutrition, epidemiology, coronary artery disease. I'll show you a couple of books related to him. This one is sort of a legacy book written by his wife. But the books he wrote himself are fantastic. He has a very logical style. When I was reading his book, it's just like everything, he's anticipating your question, answering it, anticipating your question, and he answers it. And he's one of my favorite nutrition readers to read. Like Dr. McDougall had said, don't even talk to me or debate me about nutrition unless you've read Kempner and Pritikin. And I would agree with that, because it's so obvious. It's patient after patient with Kempner and Pritikin is cured of all these Western diseases that conventional medicine never cures. Obesity, diabetes, coronary artery disease, autoimmune disease related things like abdominal pressure syndrome, diabetic retinopathy, hypertensive retinopathy, diabetic neuropathy. A lot of kidney patients stabilize. You can't always save the kidney patient. Depends how far along they are. If you catch them before the GFR gets below 60, you can often do them with great benefit. Okay, so this is one of his really wonderful books. You can watch Pritikin videos on the internet of him himself speaking. He's got a really good interview with Dr. McDougall at drmcdougall.com YouTube channel. I've made some videos about Pritikin as well and going into great detail. We got enough time today. We're making good progress. We'll go through Kempner as well. So here's Walter Kempner. Walter Kempner and Dr. McDougall are considered probably the two greatest doctors who ever lived. Walter Kempner ran the rice diet over at Duke University in Durham, North Carolina. And he found that, he had trained with Otto Warburg, Nobel Prize winning biochemist for the Warburg effect, 1931, hypoxia induces mitochondrial injury. But he also was an internal medicine kidney doctor, and he'd done research on the kidney, and he knew that, you don't want to make the kidney hypoxic. You need good blood flow to the kidney for it to function effectively. He looked at all these Asians. They're all skinny. They don't have any hypertension or diabetes, eating rice. He had this fat lady who came to see him. He was too busy at the moment. He said, just eat rice for 2 weeks, come back and see me. We'll go over everything. She came back in 2 months after only eating rice, and she had become super skinny, and all her health parameters had improved. So he's like, wow, this really works. And he started putting all these patients on a rice diet. It was primarily just rice and fruits and fruit juice, and he'd give them a multivitamin, okay? If they were losing weight too fast, he'd let them have simple sugars. Anyways, this is a nice book, a biography of Walter Kempner. It was written by Barbara Newborg. She was a younger doctor who had worked with him, okay? And it's rather amazing. Also, the free book, there's a free book for Nathan Pritikin, his legacy book. That's at drmcdougall.com website. And a free book written by Walter Kempner himself. There's two of them. The first one, volume 1's in German mostly, so you can't read much of that. But volume 2's in English, and it's quite good. I strongly recommend, if you are serious about nutrition, to read Legacy Book of Pritikin and to read Kempner's book. They're both free, and once you read those, you can't unsee it. I mean, there's nothing like it. That's one of the reasons why you see all these paleo, keto, carnivore, low-carb nonsense trolls. I don't really see much point in talking with them. It's already been proven. Low-fat, low-sodium vegan diet, that's what cures people, okay? So that really should be the standard diet. It's just that people don't want to eat it. 95% of patients, they don't want this. It's okay, there's, the volunteer, and there being a big popular club of fat, sick, and stupid people. But if you want to avoid that fate, this is your best odds to do it. Low fat, low sodium vegan with no oil. Okay, let's see here. Here's a paper. A plant-based diet and heart failure report and review of the literature. Oh, this one's by Osfeld. Yeah, he reversed congestive heart failure with a plant-based diet. Robert Osfeld, he's a cardiologist at Montefiore Hospital in New York. And Baxter Montgomery also has multiple case reports of reversing congestive heart failure. And Pritikin was, and Kempner was doing that before. Here's the case report by Baxter Montgomery. Plant-based diet, treatment for heart failure. He had a patient with an ejection fraction of 22, went back up to 42. Ideally, you'd like to get it to 55, but 42 is a lot better than 22. And that happened in just 2.5 months. Here's another. Okay, now here's Dean Ornish, and he did a study, randomized control study in 1990, reversing coronary artery disease with a low-fat plant-based diet. As in the Lancet Journal. Okay, here's one of Dean Ornish's books about reversing coronary artery disease. The only system scientifically proven to reverse heart disease without drugs or surgery. And then here's Dr. Caldwell Esselstyn, and his paper came out in the Journal of Family Practice, July 2014, and he had 198 consecutive patient volunteers. Of the ones who followed the diet, 177 of them, he said 89 were adherent. None of them had a cardiovascular event. One patient, I think, had a stroke, but he says that patient didn't follow the diet. Basically, he said the ones that followed the diet, none of them had a recurrent cardiovascular event, meaning no heart attacks, no ventricular fibrillation or stroke. Okay, so that's extraordinary. So given that most people die from a heart attack, shouldn't everybody be eating this diet? It's a low-fat, 100% vegan, no oil, no caffeine. Here's Dr. Esselstyn's great book, Prevent and Reverse Heart Disease. It's a fantastic book, and basically, Dr. McDougall said this book will be the bestseller for all time because everybody's got to protect themselves from coronary artery disease. Okay, it's a masterpiece. And the main thing Dr. Esselstyn emphasizes, if you eat a low-fat, plant-based diet, you'll maintain the arterial lining endothelium production of nitric oxide, and that will protect you from coronary artery disease. Because nitric oxide, it's a gas, diffuses into the arterial lumen. It's antithrombotic, prevents the platelets from clotting, and it's also a gas, diffuses into the wall of the artery and causes vasodilation. So the artery is wide open and the platelets don't want to clot. That's exactly what you want. Because it's low fat, you don't get rouleau formation, sticking together of the red blood cells. So it's all good. Plus it's full of fiber, and the fiber maintains the gut wall, so you don't get leaky gut, then you don't get amyloid clotting. Again, that prevents atherosclerosis. So Esselstyn had been a surgeon primarily, a lot of cancer patients, and he was a little bit frustrated with the results with that. And then he realized, gosh, people all over the world that eat low-fat plant-based diets, they don't get coronary artery disease. Why don't we try putting patients on that? Totally makes sense, okay? And he, so he did a fantastic job with that. And then, here's Esselstyn's answer. A lot of people say, oh, well, low-fat vegan diet, that's too radical, that's too extreme. He says, you think eating a plant-based diet is extreme? How about 500,000 people every year have their chest open up and a vein taken from their leg, sewn into their coronary artery? Some people would call that extreme. He says, coronary artery disease is a paper tiger and it need never exist. You can take control of your health with a low-fat vegan diet with no oil. You can make yourself heart attack proof. You no longer need to have the sword of Damocles hanging over your head. Okay? Low-fat vegan diet has 0% morbidity and 0% mortality. I mean, why wouldn't you want that? Okay. Anyways, I think we'll end it there after Caldwell Esselstyn, and we'll go with that. I hope you found that helpful.